I'm here with Levon, and Levon just had her second treatment today with the PainEraser. And there have been a number of problems that built up over the years. Levon is a young 82. She came in 2 days ago with a complaint of severe pain and immobility on the right shoulder. And that was difficult to get that shoulder up, wasn't it? It felt weak, felt painful, felt tight.
And the further I would go up,
the worse it would get. So let's have you demonstrate what you can do with that right shoulder now. How painful is that?
Not at all.
Nice, eh? So we also today worked on the left shoulder because when I first saw you, you of course were paying attention to the right shoulder. It was so bad, but the left shoulder has as many miles as the right. So we worked on that today. And the left shoulder, feeling good.
That feels good and relaxed.
Excellent. Now, for years, you've had troubles with your legs. Pain, tightness in the calves, pain around the knees, difficulty getting up and down out of chairs. And I remember 2 days ago, watching you get out of the chair in the waiting room. It's kind of tough. And big change there in the legs?
Yes. And my husband even noticed it yesterday when he
was watching you move?
I went to see him.
That's great.
He said, "Oh, you're got up good."
So let me ask you this: compared to when I first saw you 2 days ago, how much less pain in the legs, in the knees in particular?
Well, I didn't feel any when I walked around the room.
Today?
Today, after you had worked on them.
None at all?
None at all.
Beautiful. And then today was the first day that we worked on the calves, and tell me what you noticed about how the calves felt after working.
Well, they were more relaxed.
More supple.
And,
Very good. And then the last area that we worked on was this low back and pelvis, and maybe you could say a word about how that has felt.
Well, right now it isn't screaming at me, but like I said, I'll believe it when, I believe it now, but
You've had this for so long that you need the experience of seeing it last over a period of weeks to know that the experience is real.
Right.
But we think that's what you're going to see because we've had a lot of experience with this.
So is this normal for people?
Absolutely. I told you the story of my 90-year-old auntie, and she's had the same kind of response you have. And I guess the other thing about this is, as we treat you, it's not painful, correct? It's not painful to treat you. And then also you've had the experience of noticing that after treatment you don't get sore from the treatment, right?
No, right.
Yeah, so wonderful. So I want to thank you for, first of all, for coming in and letting me work with you, and I'm so happy to see your results. And thank you for sharing your experience with the PainEraser.
Hopefully it helped.
It's good to let people know about this because, you know, the relief that you've had in 2 treatments is, I think, far beyond what you expected.
So why would I come more?
Oh, why would we do more treatments on this? We'd probably do maybe 2 or 3 more treatments over the next month to get you to the point that you really have you have the best strength and flexibility that you could have. The point you're at now, if I might venture a thought here, is that 2 days ago, you know, you remember you were so worried that, gosh, you know, it's hard enough to get around. If this makes me worse, I'm really in trouble. It was a big worry, a legitimate worry. But what you've seen, and so what I'm saying is, I think that your standards were set fairly low. Your expectations were set very low. Now you're feeling a lot better. And I think in the coming days, you're going to be thinking about, hey, wait a minute, how much better could I feel? You know what I mean? How much stronger, how much more flexible could I be? How much more endurance could I have in my legs? How much more could I walk around the shopping mall and spend my money. So, anyway, that's the reason that we would do a bit more treatment. You've come from the point where you were feeling really kind of badly a couple
But you
days
know,
ago.
exercising, you should do them every day, but this wouldn't benefit.
This you don't need to do every day. The idea of this work is to release those reflexes that keep everything tight, to release the web of scar tissue in the joints and muscles and such. And once that's done, it just doesn't need to be done over and over and over again. So probably we'll do 3 or 4 more treatments over these coming weeks, and perhaps every now and again, every few months, you might want to come in. But you mentioned exercise, and one of the things that I think you'll notice is that your capacity to do exercise, to keep yourself strong and to keep yourself flexible, will be much greater because you don't have pain.
Yes, I can relate to that.
Yes. All right. So, Levon, thanks again,
Uh-huh.
and thanks for being with us on camera.